Welcome to Baylor Scott & White Health Plan's annual Notice of Change for North Texas. We are excited to share the changes that will be made to your Medicare Advantage plans effective January 1st, 2026. Today, we will discuss what is changing for 2026. We will also share a few of our SeniorCare Advantage highlights and discuss two upcoming Medicare Advantage election plans. Then, we will review the changes to each of our Baylor Scott & White SeniorCare Advantage plans, their medical benefits, prescription drug coverage, and extra benefits. Lastly, we will share the contact information for the departments and benefits discussed. Here are some highlights for our Medicare plan. Bonus benefits are included in the plan, such as routine dental, routine vision, and routine hearing visits, a quarterly over-the-counter allowance, no referrals are required to see a specialist, there is a no cost for telehealth visits with primary care physicians, specialists, or psychiatrists. The plans also offer $0 copays for many mail order prescriptions. We have preferred pharmacies that offer lower prescription copays. Worldwide emergency room and urgent care coverage is included. There are two upcoming Medicare Advantage election periods that allow Medicare Advantage members to make a plan change. The first is the annual election period, AEP. This allows Medicare Advantage eligible individuals to enroll or disenroll from a Medicare Advantage plan from October 15th through December 7th each year. A plan selection made during this time would become effective January 1st of the next year. The Medicare Advantage Open Enrollment Period, OEP, takes place annually from January 1st through March 31st and allows individuals enrolled in a Medicare Advantage plan to make a one-time election to go to another Medicare Advantage plan or Original Medicare. Individuals using the OEP to make a change may use a coordinating add to change or drop Part D coverage. So, what is changing for 2026? CMS is ending the Value-Based Insurance Design VBID program on December 31st, 2025. Baylor Scott & White SeniorCare Advantage SelectRx Assist will change its name to Baylor Scott & White SeniorCare Advantage Essentials. At Baylor Scott & White Health Plan, we want you to live your best life. As a Baylor Scott & White Health Plan member, you have access to the Baylor Scott & White Quality Alliance and their unique resources, including specialized 65-plus care coordination tools. We want to help you get the right care at the right time at the right place. 60 visits. These are offered at certain clinics in North Texas and Central Texas, as well as virtually. These visits provide patients with a personalized assessment up to 1 hour to review your health history, discuss your health needs and goals, and connect you with resources that may be helpful. After the 360 visit, your primary care provider will continue to manage your care needs. A follow-up visit will be scheduled with them. These visits are based on specific eligibility and criteria. One of the groups of patients who are eligible for this visit are patients who are new to the Scott & White SeniorCare Health Plan. Interested patients can talk with their Baylor Scott & White doctor about their 360 visit eligibility. The 65 plus clinics are located within CDM Temple, Killeen Family Medicine, Coppers Cove Family Medicine, Georgetown, and DDA Plano coming soon. Provide care to patients 60 years and older with multiple chronic illnesses. Your first visit is up to 1 hour long to review your medical history and introduce you to your members of the care team. You may have more visits as needed with your care team, and you will have access to the 65 plus clinic dedicated phone line. One of our 65 plus clinic patients said the amount of time they get to spend with their provider is priceless. This clinic is based on specific eligibility and criteria. Interested patients can talk with their Baylor Scott & White primary care provider about their 65 plus clinic eligibility. CareNav Plus is a one-stop shop resource for your healthcare needs and services. Our care navigators can assist you with clinical needs and guide you to the right level of care, help you with medication refills, answer your billing questions, offer My BSW Health app support, and educate you on your insurance benefits. You have access to CareNav Plus Monday through Friday from 8 a.m. to 5 p.m. The phone number is 833-818-1339. The Kidney Health Program helps patients better manage their chronic kidney disease and related conditions such as diabetes or high blood pressure. Additionally, if a patient's CKD worsens into end-stage renal disease, Kidney Health Program supports patients during and after this transition by helping them understand treatment options and make hard decisions. Patients can access their care team through phone calls, video, or two-way texting. The texting feature also provides personalized health education, reminders, and check-ins. To get started, patients can talk with their provider about referring them for care management. Now we will take a look at some important changes to Medicare Part D. The out-of-pocket threshold has changed to $2,100, and during the catastrophic phase, members pay $0. Medicare is continuing the prescription payment plan. This is not a mandatory plan. It gives you the option to spread out the costs of your prescription over the plan year. Again, this is not a mandatory plan. Mail order prescriptions. In August, the mail order prescriptions changed to Costco Pharmacy. Many of you already know about this change and are actively using the program. For those of you who want to utilize the mail order prescription services, contact resources will be shared at the end of this meeting. You are still able to use your retail pharmacy. Visit mybswhealth.com, log into your member portal to enroll and manage your active mail order prescriptions and your preferred retail pharmacy. Our HMO POS plans cover 7 counties across North Texas. New for 2026, Johnson County. Included in North Texas, Select and Select RX, and SeniorCare Advantage Essentials HMO POS. Let's discuss the HMO POS medical benefits. HMO POS plans require you to use an in-network provider. As a member of one of our HMO POS plans, you have access to all Baylor Scott & White health providers across Central and North Texas. The monthly premium for both plans will remain at $0. The only HMO POS Select without RX pays $50 toward your Part B premium. This reduction is applied to your Social Security check. Contact Social Security or go to ssa.gov for more information. The annual maximum out-of-pocket does not include prescription drugs. The out-of-pocket maximums will remain the same for 2026. There are no changes to the primary copays and specialty copays. Skilled nursing facility care allowance has changed on days 21 to 100. The Select and Select RX changed to $218 per day. Inpatient hospital allowance has changed on days 1 through 6 to $225 per day. Emergency care has changed to a $130 copay for the Select and Preferred plans. Chiropractic services now have a $15 copay. The first and most exciting change is eye exams, eyewear, hearing exams, and hearing aids will now be point of service for 2026. This means you may receive the benefit from any provider. A gym or fitness club membership is included and provided by Silver and Fit. You have access to both the in-home program and a gym membership. You can search for a gym at silverandfit.com or give us a call for more information. We have a preferred and standard pharmacy network. Reduced drug copays are available through our preferred pharmacy network. The Select RX deductible for tiers 3 through 5 changes to $250. The others remain the same. For 2026, the maximum out-of-pocket you will pay is $2,100, and during the catastrophic phase, there are $0 copays. Tier 4 has changed to 35% coinsurance for the HMO POS plans. Tier 5, the Select RX plan has changed to 30% coinsurance. Tier 4 mail order will be changing to 35% coinsurance. Members must use network pharmacies. No out-of-network benefits. Most adult Part D vaccines are covered at no cost to you. And now for 2026, the introduction of the Baylor Scott & White SeniorCare Advantage Essentials HMO POS plan. Only a name change from Select RX Assist from previous years has occurred. Changing in 2026 on the medical benefits for the Advantage Essentials HMO POS plans, the monthly premium remains at $0 with extra help and changes to $4.80 without extra help. Skilled nursing facility care allowance, days 21 to 100, change to $218 per day. Inpatient hospital allowance, days 1 through 6, change to $225 per day. Emergency care changes to a $130 copay, and chiropractic services change to a $15 copay. The eyewear allowance for the Baylor Scott & White SeniorCare Advantage Essentials HMO POS has changed to $150 for 2026. Routine hearing exams are also included at a $0 copay. The hearing aid allowance will remain the same on the Essentials HMO POS for 2026. This allowance can be used towards the purchase of hearing aids once every 3 years. The over-the-counter allowance will remain the same, except on this specific plan, the grocery benefit will no longer be included in 2026. Prescription drug benefits on the SeniorCare Advantage Essentials HMO POS changes include: the deductible for this plan without extra help has changed to $615. With extra help remains at a $0 deductible. The out-of-pocket maximum for 2026 is $2,100 with or without extra help. And now on to the PPO plan. Here's an overview of the PPO medical benefits for 2026. There aren't many changes for the upcoming year. Monthly premium for the basic plan is still $0. Skilled nursing facility care allowance on the plan changes to $218 for days 21 to 100. Emergency care copays have changed to $130, and chiropractic services have a copay of $15. Our supplemental benefits for the SeniorCare Advantage PPO plan: the hearing aid allowance can be used once every 3 years, including OTC or prescription hearing aids. The dental annual benefit allowance has remained at $3,500. There's still a 50% coinsurance for dentures. Annual exams have changed to a $0 copay. The over-the-counter benefit, the OTC card, will remain at $80 per quarter. The prescription drug benefits on the PPO plan remains largely the same. Changes include the total out-of-pocket will be $2,100 for 2026. Tier 4 drugs have changed to 35% co-insurance. To help you take full advantage of your benefits, please make note of these helpful resources. If you need assistance using any of your benefits, please give our customer service a call using the number at the top left of the screen. That number is 866-334-3141. And this brings us to the end of the annual Notice of Change presentation for North Texas. If there are any questions about these changes, we are more than happy to assist you. If you have specific questions about your plans, please call our excellent customer service department at 866-334-3141.